Welcome back.
OTC, it's too easy to have one too many, you'll get caught in a cycle.
Welcome back.
Although the percentage of teens using illegal drugs is down, the number of teens abusing prescription medications and over-the-counter drugs have reached record highs. It's said that about 10% of teens, which is about 2.5 million, have reported using cough syrup just to get high. 1 in 11 teens have abused over-the-counter medications.
Dextromethorphan, or DXM, is the active ingredient found in OTC cough and cold medications. When taken in recommended doses, these medications are safe and effective.
Individuals who abuse DXM consume much higher doses, typically more than 360 milligrams, produce hallucinogens and dissociative effects. While under the influence of the drug, which can last at least 6 hours, DXM abusers risk injuring themselves and injuring others because of the effect of the drug on visual perception and cognitive processes.
Some street names for DXM are Candy, CCC, Dex, DM, Drex, Red Devils, Robo, Rojo, Skittles, Tucson, Velvet, and Vitamin D.
More than 15% of high school seniors say they have taken at least one prescription drug or OTC pill for non-medical purposes within the last 12 months. And in 2005, the National Survey on Drug Use and Health revealed that more than 2 million teens had abused prescription and OTC drugs.
Some short-term effects for taking OTCs are impaired judgment, nausea, loss of coordination, headaches, hot flashes, and hallucinations.
Long-term effects include addiction, insomnia, high blood pressure, comas, severe organ damage, and even death.
Some hazards with improper use are severe pain, high blood pressure and heart rate, AMS, which is altered mental state, nausea, vomiting, and seizing.
Over-the-counter medication is not illegal. You can buy it anywhere at any age. That's part of the reason that it's so populated with abuse.
The first over-the-counter medications were introduced in 1704 and remained relatively the same until about 1960, when the concern shifted to make them safer. The administrators have been fighting not to have certain drugs available to just anyone, but that's exactly what's happening. More and more drugs have become OTC ready.
The following information are excuses of why people take over-the-counter medication incorrectly, and warning signs you should be aware of if someone you know is abusing. Some take drugs recreationally to get high, while others cite to help sleep problems or concentration lapse, and others use it to help pain that may not even exist.
Frequent visits to pro-drug internet sites that have information about how to obtain and use the OTC drugs to get high.
Changes in interest and hobbies.
Disrupted sleeping patterns.
Missing medications from the medicine cabinet, especially cough and cold preparations.
Empty cough syrup bottles or cold blister packs among personal effects or in the car.
Changes in friends, appearance, hygiene, or behavior.
Negative changes in school performance, such as missing school or declining grades.
Increased secrecy about activities or possessions.
Changes in conversations with friends, such as increased secrecy or talking in a coded language.
Alright, so this is the part in the presentation where you get to get involved, because I know you want to. And what we're going to do is we're going to hand out one of these, which is a word find with words on it that you have to find. And so we're going to pause the video and we're going to give you guys a few minutes to do it. And the first 3 people to find 5 out of the 10 words gets a candy bar brought to you by Jenny.